Hello, welcome back to EndoBites, where we bring you practical bite-sized endocrine insights. We talk about everyday endocrine conditions that you manage in your clinic every day. And these episodes are tailored for primary care providers, students, advanced practice providers, and anyone who is eager to understand our endocrinologic conditions and manage them on their own without a consultation. I am your host, Dr. Vidya Kidambi, Chief of the Division of Endocrinology and Molecular Medicine at the Medical College of Wisconsin. And in our first episode, we covered fundamentals of bone health. We talked about bone formation and resorption and peak bone mass and how age affects the bone loss. Today in episode 2, we are zooming in on two of the most important minerals that are essential for bone health, calcium and phosphorus. These aren't just lab values, but they are central to how the bone is built, maintained, and how they protect the skeleton. Whether you're managing osteoporosis or evaluating calcium level or recommending supplements, it's important to understand where calcium and phosphorus stand. I'm once again joined by Dr. Julia Shariff, who is our assistant professor in the Division of Endocrinology and Molecular Medicine at the Medical College of Wisconsin. Welcome back, Julia.
Thanks, Vidya. Thanks for continuing the series. These topics come up a lot in everyday practice.
Yes, that's why, in fact, it seems like the calcium and phosphorus, as common as they are, I'm almost always kind of, when the patient asks, I'm trying to look up, okay, where is this calcium? So That's where I am. I thought this is important to spend some time on how the calcium is absorbed and where we can find calcium and phosphorus. So here is our first question for today. How is calcium absorbed and regulated in the body?
Calcium is absorbed primarily via vitamin D mechanisms. So vitamin D is a fat-soluble vitamin. We'll talk a little bit about this in future episodes, I believe. But it is absorbed, it is taken up by the sun, or through supplements or diet, and then converted to its active form, 125 vitamin D, in the kidney, actually. The kidney has an enzyme called 1-alpha hydroxylase. It's converted that way. And this allows calcium to be absorbed in the level of the gut, usually through the duodenum and the jejunum. So vitamin D, through various mechanisms, allows that calcium to be pulled in through to the cells. Calcium can be absorbed via an active mechanism, via receptors, or passively into the cell as well. Optimally, the environment that calcium is absorbed in is important. Calcium is a very finicky type of molecule that's absorbed. So you want to make sure that there's some more acidic environments for calcium to be absorbed because it allows for the ionization of calcium. So for instance, when people are on proton pump inhibitors, so those medicines we use for acid reflux very, very commonly, that can actually interfere with calcium absorption and potentially lead to changes in people's bone health because they can't absorb that calcium. So that's how it's absorbed primarily. And regulation is more complex. So it's regulated primarily by parathyroid hormone, which is a hormone that comes from 4 tiny glands in the neck. These glands secrete parathyroid hormone in response to typically low calcium. So if your body's not getting enough calcium, you're not getting enough milk, cheese, yogurt, that enzyme or that hormone will get released. And this leads to increased calcium taken out from the bone, reabsorbed at the level of the kidney, and absorbed at the level of the gut. And then this happens, it brings the levels of the calcium back up in the blood and keeps it in balance and homeostasis. Reflexively, you can have too much calcium in the blood. So if somebody has really bad acid reflux, they're taking a lot of Tums, for instance, that calcium level is really high. The parathyroid hormones will actually sense this via the calcium sensing receptor and then shut off or suppress. And this prevents more bone turnover, release of calcium from the bone, reduces that reabsorption at the kidney and the gut as well. So it's something called negative feedback, which we see a lot in endocrine physiology, and it's something the parathyroid hormone does that's their main function. So in a way, calcium kind of regulates itself by binding and sending negative feedback, but parathyroid hormone has a massive role in that regulation process.
So it looks like, calcium, vitamin D, and parathyroid hormone, those 3 kind of work hand in hand, maintain calcium levels in the blood. The calcium is such an essential part because when I'm trying to explain patients about high calcium or low calcium, calcium is needed for everything, right? So bone is the store of calcium, but muscle, the heart muscle nerve function. So absolutely needs to be maintained in a very tight level, because very low could result in a really serious consequences. So to maintain that, we have a really great mechanism, it looks like, to maintain that. Now, it's it's a cousin or little brother, the phosphorus, extremely important, but we don't hear too much about it unless someone is in ICU, has low phosphorus. But I figure that it's also extremely important for bone health. So tell us a little bit about the role of phosphorus.
Yes, you hit that right on the head. Phosphorus is so important, but we don't think about phosphorus. It's not something like, well, I should really get my 3 servings of phosphorus per day. But phosphorus is very important. What its role is primarily in mineralization of the bone, so the kind of the strength, the part of the bone that we get. And it does this by complexing with calcium to form hydroxyapatite, which is that primary mineral component of bone. So it has that foundation part. That's part of what the osteoblasts are doing when they're forming bone, is using that hydroxyapatite. So it's crucial, and it's, like you said, not something we think about every day.
All right. So let's talk a little bit about the dietary source of calcium and phosphorus. So obviously, we don't want everyone to be taking calcium supplements if we get enough from the diet. So let's talk a little bit first about the calcium, how much calcium is needed, and where can we find them if I don't want to take supplements?
Yes, and a lot of patients are are very cautious about taking supplements, right? Because ideally, the best way to get calcium is from food. So the primary sources of calcium, and our goal is usually around 1,000 to 1,200 milligrams per day, especially in postmenopausal women and people who have osteoporosis. The main sources are dairy. So we think about milk, cheese, yogurt, primary sources. But you can also get it from plant-based sources. So I have a lot of patients who don't tolerate dairy or lactose intolerant. So they ask me, how do I get calcium? Plant-based milks are a good source depending on if they're fortified. So almond milk is usually a really good source if it's fortified, about 450 milligrams, generally speaking. But there are other types of plant-based milks that aren't fortified. So you should really look at your label for your oat milks, rice milk, coconut, things like that, to make sure it's fortified with calcium. Other non-dairy, non-plant-based milk sources include things like tofu, broccoli, leafy greens, nuts, fortified grains, fortified orange juice, ideally low sugar orange juice if you can. And so there's lots of different sources of calcium that aren't dairy. So a lot of people think, oh, I can't get calcium because I have lactose intolerance. So there's lots of other ways you can get it. A common misconception I do get from patients that I always like to touch on is eggs. Eggs don't have that much calcium, despite what you may think, unless you're eating the shell. So I don't recommend doing that. So eggs aren't the best source, but they're a great source of protein and actually are a good source of phosphorus, which I know you were wondering about too. So eggs have phosphorus, as well as meat, poultry, nuts, beans, anything that has a cell membrane usually should have some phosphorus in it. And that's why we don't usually need phosphorus supplementation. Most people don't, because we get so much of it in our Western diet that you don't need to actually add on more phosphorus in a pill or a powder.
Okay. So basically, for any of these, other than regular dairy and regular yogurt, so if you're consuming any kind of alternate types of dairy products, we have to just look at it and see the serving size and how much calcium there is on it.
Absolutely.
And, so talk a little bit about the sources of phosphorus.
Yes. So sources of phosphorus mainly are, again, like I said, the animal cells, plant cells, so meat, poultry, you can have some in the eggs like I talked about. And then beans are a big one that people don't often think about. But you can really, if you look at the list of phosphorus sources, you can find it in pretty much anything. You can even get it in soda, right? Soda has phosphorus, which again, don't recommend, highly kind of discourage if you have too much soda. But it's found in, again, any like animal and plant-based sources pretty much if you look at those lists. But meat and poultry and eggs are the primary ones that they talk about.
All right. So, and that's a wrap on episode 2. Julia, thank you so much for enlightening us on calcium and phosphorus and their role in bone health. So next time on Endobites, we welcome Dr. Joe Shaker, an expert in bone metabolism, for an episode entitled Vitamin D and Bone Health. And hopefully you'll join us next time.